Hi, so please tell us your name and the medical school that you're from.
Okay. I'm Emmanuel Turks-Nokran, and I was in Wenzhou Medical University in China. Yeah.
So how do you find you're in the middle of a rotation now, is that correct?
hmm Yeah, I am.
And could you describe the rotation and just tell us what you think overall, what your experience has been so far?
Okay. So, I started the rotation a couple of weeks ago, and I'm with an internist, and what we usually do every day is we usually go early in the morning and then review the patients, and we have like a usually the doctor usually gives us some questions like to work on when we go home and some assignments to read on. And when we come, usually these questions and stuff are kind of related to the cases we see in the hospital. So then we have at the end of reviewing the patients, we have a discussion where he asks us questions. If there's stuff we don't understand, he kind of like explains it to us, and basically just learning how the medical system in the US works, because it's kind of different from in other countries, and it's been a really good experience. I've enjoyed it so far because I've learned to work with nurses over here, like actually be part of the medical system over here and actually learn as well. Yeah.
What's been so you're in different what kind of okay, two questions. One,
hmm
what kind of environments do you find yourself in? Like maybe a typical like during the week,
hmm
you could tell us what types of environments you're in, and then two, anything that you did find different or surprising, or like a particular anecdote about something that's occurred, I guess, during the rotation that you maybe weren't expecting when you started it.
Okay. Um, with the first question. So, okay, actually, let me start with the second one. So, one of the things I wasn't honestly expecting is to actually have a hands-on experience, like with the patients, and because usually if you're from outside, you are unless finished all your USMLEs and everything, you are not usually, from what I've heard, you're not allowed to actually have a hands-on experience with the patient. But with what I've experienced so far, I'm actually kind of like involved with the patient's care. So I like the doctor will ask me how I would manage certain cases, what I think about this, what I think about that, and I give him my input, and then he also lets me know if there's something I've left out, if there's something I'm supposed to do better, and stuff like that. So
But
that's actually very interesting.
for the record, it is under his supervision, right? That's the whole point.
Yeah, yeah, it's definitely on his supervision.
Yeah,
So it's all with him. It's
yeah.
all with him. So we'll go to the
That's
patient.
by the way, that's what keeps it, legal. So that's
Yeah,
that's
exactly.
but I'm happy that you found it surprising that you're able to be as involved because it's true that a lot
Yeah.
of the trainees that will contact me,
Mhm.
they just sort of assume that they're very limited,
Mhm.
that all they can do is an observership, and I always have to
Yeah.
remind them that it's not
Yeah.
an observership. It's an externship, a hands-on rotation
Mhm.
that you
Yeah.
get to be involved and you get to learn a lot that way.
Yeah. So I was actually really glad when I realized that, because you we'll go with him to see the patients, and then he'll ask us to get a brief history from the patients, and then we'll do a quick physical, and then judging from what we see, he'll ask us what we think might be wrong with the patient, and then we'll talk about differentials, how to manage certain cases, and all of that. So it's actually really a really good experience.
Is it better than what you were expecting, even when I told you about it?
Yeah, it is better than what I was expecting.
Okay,
It is
cool.
better than what I was expecting. Yeah. And the kind of environment we usually find ourselves in. So the doctor I'm with is more of a geriatric internist. So we usually find ourselves either in like a nursing home or in some other kind of primary care environment.
Is it like, I guess we call it acute care facility?
Okay. Okay. So okay, over here then it's called acute care facility. Okay, yeah. So yeah, those are the most of the environments we find ourselves in. So most of the patients we see are the older ones, but he also has some patients that aren't you wouldn't exactly say are old people, if you know what I'm saying. Yeah. So yeah, and we kind of like every every day of the week we kind of like alternate between a couple of different places. So yeah.
Does he also have his own outpatient facility, his own outpatient clinic?
Yeah, he does. He does.
Okay.
So he
It
has one.
varies between, my understanding was that
Uh-huh.
it kind of varies between the outpatient, his own outpatient
Hmm.
facility, but that you do have, like every day, a lot of exposure in the acute care facilities as well.
Yeah, yeah, yeah.
So,
We've actually had I've actually had a lot of experience exposure in the acute care facility because the first day I actually went to his outpatient clinic, and he was actually telling me that it would be I would actually learn more at the acute care facilities than just being at the outpatient clinics,
right.
and it is true because at the acute care facilities, you actually see more patients with him and everything. So it's really good.
Okay, well, thank you for, taking the time to chat with me
Huh?
on, you know, video recording.
No problem.
I do hope we can, if you're interested to work together again,
Yeah,
um,
yeah,
set something up for another rotation.
yeah, yeah. I'd love that.
All right, cool. So thanks again. I'll close this. We can chat
Okay,
more after I turn it off.
okay, sure.